Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. You know, we have joining us on the program today one of our industry friends, member of our League of Leaders, and also somebody that was way out ahead of the exchange market. Welcome to the program, Josh Hilgers, founder and president of Health Partners America. Morning, Josh.
Good morning, Doug. How are you?
I'm good, buddy. And to our audience, let me tell you, 3-4 years ago, I saw Josh walking around, trade shows with his iPad, talking about this thing called exchanges, and everyone kind of had blank stares. But here we are sitting on top of probably the single most, important open enrollment period. And hats off to you, Josh, for being one of the industry's foremost thought leaders to take this initiative forward.
Thanks, Doug. I appreciate that. We've are definitely this is a crazy week for us, staying on top of everything. It's been exciting to see some of the carriers and the rates and the numbers finally start coming out, and I think clarity for the industry is going to be good, no matter what your political leanings are. Knowing what we're dealing with is important.
Yeah, absolutely. Hey, Josh, give us just a minute or so synopsis on Health Partners of America, because I want to make sure before we get into some of the questions that our audience really understands Health Partners of America and your unique model for this marketplace right now.
Sure. Well, I started Health Partners America. I was a broker. I was out there working with small business owners, individuals, trying to help them solve, what had become a health insurance or healthcare crisis for themselves, trying to afford and provide benefits for either their family or for their small business, and partnering with local TPA and working with the tax advantage accounts, defined contribution plans, some of the more consumer-driven models with higher deductibles and HRAs and HSAs, and we really had created a pretty good model ahead of that and understood that there was going to be a drive or a need for a role for individual health insurance plans in the future. And so that's really where we got our start. So one of our unique advantages is that everything we've done has been forged from the front lines, and I'm still constantly, and my team are working with brokers, providing solutions to business owners. A lot of business owners are a lot larger nowadays, but we're out there on the front line. So, we're not a technology company. We're not a leads company. We're not disconnected from the industry. We truly are a broker support organization. And our mission is to build a community of industry rock stars. Mm-hmm. So we know it's very difficult right now to stay ahead of all of the information that comes out, know what its impact is, and then turn around and know how to apply that to a broker's business and whatever their focus is. So that's what we're here to do. We're the back office for over 700 different producers now. We're powering exchanges for them and for their clients. We're providing fulfillment for individual health insurance and individual ancillary insurance needs, and providing a way for producers to really stay relevant, provide strategy, and focus on those relationships. But it's a different world, as you guys know and talk about every week, and it's just important more now than ever for a broker to have some help.
Yeah, you're right. Hey, give us a look-see over the next 3-4 months. How do you see this enrollment period, which is, probably the most important one in our lifetimes? How do you see this playing out, both private, public exchanges, how it all works together, the market outside of exchanges? How do you see it playing out from your seat?
Well, I think one of the most important decisions that was made was allowing private exchanges multiple pathways to facilitate the subsidies. I think there was a lot of pushback, and I think the survey results that this administration kept saying was that people don't trust a government exchange. People don't want to go to a government-run website to find health insurance for their family. And so they're outsourcing or partnering with private exchanges like our model or eHealth Insurance or some of the other web-based entities that have been approved that can facilitate that. I think was a good decision. It's definitely going to make it easier for the consumer because, our fulfillment agents and eHealth and these other models have been working with consumers for years. We just now have, the subsidy and the eligibility there. I do think we're going to see this really be more of a soft launch because right now we're going to be seeing that market for the uninsured, for those that are buying their own health insurance who maybe make less than 400% of the federal poverty level, a lot of part-time employees looking. But I really think that the first quarter of next year is when we're going to start seeing some business owners make decisions when, they realize that they may not be helping their employees out, and we may start seeing a shift from that group model to individual insurance playing more a role in employee benefits.
Now, Josh, there's, in a lot of the discussions I'm sure you're having and we're having is there's when you tell people about, sometimes you even say private healthcare exchanges and people automatically think government healthcare exchange, but there's a unique difference between the two, right? That everybody needs to understand.
Yeah, absolutely. The government exchanges, their charter really limits them to focus on, the health insurance for the 3 to, I think the state with the most might have 16 different carriers, and they only are offering the qualified health plan. Some of them are offering some dental insurance, but, our exchange model is, allowing for the qualified and non-qualified health plans, some of the more affordable alternatives for those that don't qualify for a subsidy, like short-term medical, and then, of course, your ancillary products. You can't really separate the two, our focus on helping consumers move into more of a consumer-driven model like I have, and I'm sure you guys have, with the higher deductible. They may want a critical illness or an accident plan to help set their out-of-pocket costs. They may want dental insurance, and they all work together to form, a family's budget for their financing their health care. And so to really kind of separate out one piece of that doesn't make much sense. And that's why a private exchange will have a lot of advantages just from the amount of products, the amount of carriers that are in them. It also can be branded and focused specifically on what an organization or an employer or an agency wants to promote. So even non-insurance products, we get calls from non-insurance products. There's a lot of prepaid legal type products. There's pet insurance, there's telemedicine. There are all types of, benefit, direct-to-consumer products that are on the fringes that really can help consumers save money that can be found in a private exchange and not in a government-run exchange. And then, of course, there's just the overall approval ratings of our government right now are not at historically high levels by any means. And so the trust factor there of, hey, these people have slapped this thing together. If I go there and need someone to help me make a decision on my health insurance, who am I going to be talking to? Right. Is it the folks down at the library and the DMV taking these? People just don't understand where that expertise is because the government doesn't have it. And so being able to work with an exchange partner or, go to a place where they know the consumer's best interest is at heart and give them truly what's going to be best for them. And if they are eligible for any of those federal subsidies, be able to, qualify and apply them in the private exchange was a huge decision.
Yeah, absolutely. Josh, what you're talking about, exchanges are simply a whole new benefit delivery and distribution platform. And I think those private exchanges that embrace that and are presenting to the employee and their families that more complete benefit experience are going to be the winners. Do you agree?
I agree 100%. And, I think to Brent's point earlier, private exchanges have been probably one of the most widely defined terms. We talk a lot about our exchanges being focused on fulfilling the individual insurance. Of course, there are exchange models that are the group models, and defined contribution can be applied in a group setting, and there's choices there, not as many choices, but choices there. I think it's definitely a good first step for any employer who's wanting to continue to offer a group insurance platform. So it is difficult to because it is a pretty broadly defined term. When someone throws out the word, exchange or private exchange, you don't know exactly, who their focus is on and what their capabilities are. But the overall concept that our distribution, communication, administration, and enrollment of benefits is shifting because of the efficiencies that are brought about by the technology powering exchanges.
Yeah, and I think to your point earlier too, along these lines, that's the importance of the broker too. These, the employers and their families need help, and the brokers, you having a broker-centric model, allows that trusted advisor to remain in place and showcase, a private exchange option, a pathway to government exchange if you are that qualified, subsidized employee. So I think, brokers have a real role to play. And I think if we go back to when, the debate on healthcare law and even the passive healthcare law, it was very anti-broker. And it's interesting to see how it's kind of turned itself around and sees the importance of embracing that broker.
Yeah, I agree. And I think that was a key in them making the decision to allow a private exchange to facilitate those subsidies, is because they realized a website can't sell insurance. We've got to connect these people to a licensed expert. It's not like Amazon that you can just go click, read a review, and you know what you're looking at. You got to be looking at something, which is, the exchanges and the websites, but you got to be talking to someone. This is way too complicated to just be able to look on a website and be able to purchase. And so, and that's when you get down to the individual needs of an individual or a family, but also the new role of a broker who's working with the employer and understanding how and why his employees may not want him to offer group insurance, to understand some of the strategies around defined contribution, individual health insurance, the different, there's just new dynamics in the marketplace that haven't been there before. You're right, we have been ahead of the curve in seeing them coming and being able to put out some training, some tools, and some technology to help the brokers, profit from it. But I think there's going to be a very sharp learning curve now that they're here and on top of us, where some brokers are going to get caught a little flat-footed and some are prepared, but it's definitely going to change the way we all look at how we've been doing business.
Now, just one of the things that you've always been on the forefront of this, and with the launch of privatehealthcareexchange.com, we're trying to aggregate everybody together so they understand all these different models out there, because your models might be different from somebody's model who is, maybe across the country. You talk about, the private exchange broker blueprint, and I'm assuming that's a product of yours. And then, what is the difference between your exchange and what others might be looking at out there?
Sure. The private exchange broker blueprint is really what it says. It's not just the exchange, but a blueprint, a plan, and how to use it and how to understand how this market's changing, what you need to do to take advantage of it. And so we provide the training, and it's ongoing training. So we've got, modules in there that go back 2 years explaining what's going to be happening and how the technology is going to be working. But we also do weekly coaching calls with, gurus on health reform and on marketing. And, we truly are trying to, anything that a broker would need to be able to stay on top of, we're providing in those weekly coaching calls. We've got account managers and national sales directors who are going on and working with these brokers and closing deals and helping employers understand what their options are going to be. So it's truly a plan, and it's a complete all the way from the training and the tools through the implementation.
Hey, Josh, we're at the end of our segment here, and I want to, first of all, thank you again for participating with us. I also want to let our audience know that you can join Josh and the rest of us at IHC Forum West. I think Forum West on December 5th and 6th in Las Vegas is going to be a very interesting real-time look-in, and you're going to be able to hear perspectives from Josh and others on what is happening during this critical fall enrollment period. You can also find information on Josh's company at our website, theihcc.com. And Josh, good luck this enrollment season, my friend. We'll see you soon.
Yeah, thanks, Doug. And this is going to be the one time what happens in Vegas shouldn't stay in Vegas, right?
That's exactly right. Good point.
We're going to have some information to take back with us and apply. It's going to be wonderful.
You got it. See you, my friend. Take care.
All right. To everybody else, stay tuned for the next segment of Healthcare Consumerism Radio.